the perfect segue to introduce
Yeah.
Laura Collister, the CEO of Wellways Australia, and she has been since the end of last year. And having previously been Director of Services Research and Development, and prior to joining Wellways, Laura was a lecturer at La Trobe and had a leading role in developing the university's mental health curriculum. And I'm pretty confident Laura and I met when we were both working in the psychiatric services of the late 1980s and 90s, where Laura was assisting residents to prepare for community living. So, Laura, thanks for your support. Thanks for being here today. And we look forward to hearing the Wellways view about housing and support.
Thanks, Jenny. Before I start, I will acknowledge the traditional owners of the land that we meet upon and pay my respects to their elders past, present, and affirm my commitment and my recognition of their emerging leaders and my commitment to work with them in partnership into the future. Following Sarah and Joe, who have stolen most of my thunder, I have prepared a different angle, I guess, to answer your question, Jenny. There's a lot that we all know, and probably everybody in this room knows, about the centrality of housing, that it's a fundamental foundation upon which people can build recovery. We also know that mental health support for a lot of people is an absolutely critical component. And as Sarah said, that this support often needs to be counted in years and not months for some people. All of us sitting in this room, I think, recognise that the systems and the context of which we work means that housing agencies often do not have the resources to offer mental health support in an ongoing kind of way, of the nature that Sarah and Joe have talked about. And equally, mental health agencies do not have access to rapid housing at all. So, I mean, those sorts of facts in my mind self-evident. We don't need any more evidence to support these approaches. Joe mentioned Doorway, and so I wanted to speak briefly about Doorway. Most people probably in the room have heard about Doorway. It uses private rental as an accommodation option for people who experience significant mental health issues. It uses private rental as an option because in our mind, it is an underutilised kind of option for people. Certainly it isn't the only option or a solution for all people, but it is a solution that we've put forward, and fortunately the state government has funded us to support people into private rental. One of the critical components of that is a relationship that is made with the real estate agents in the community. And it's that angle that I want to take in thinking about the sorts of models that in my experience work. Doorway is built on a partnership with clinical mental health services, Wellways as a mental health provider, and these real estate agents in the community. When we first opened Doorway, not every real estate agent wanted to work with us at all, particularly real estate agents in small communities who knew the people that we were actually working with, and some of them were on the real estate agent blacklist, meaning that these people were known to be not good candidates for private rental at all. We at Wellways set about working with those real estate agents to change attitudes. We had an absolute deliberate strategy to not only change their attitudes, but change their behaviour towards the group of people we were helping. How did we do that? We worked in partnership with them. We worked with them so that they would see a person that they were finding accommodation for, not somebody who was a problem, somebody who was homeless, someone who had a mental illness, somebody who had drug issues, etc., etc. A familiar story, I know. We did that by providing really positive, supportive interactions with people who we were trying to find accommodation for. And this didn't happen overnight, but now, a number of years into the Doorway program, We have real estate agents who positively discriminate to find suitable, affordable, safe accommodation for the cohort that we are trying to work with and we are working with. They seek us out and say, we have accommodation that would be perfect for the people that you are working with. And over time, they've developed their confidence, as our tenants have developed their confidence to work directly with real estate agents without Wellways being in the middle of that interaction. And I think that's really important. So we see real estate agents in the community as a critical asset towards delivering the Doorway program. So when Noel asked me to write this opinion piece, I thought about what I could possibly talk about, and I reflected on a very personal experience that I have in my local community. I live in inner city Melbourne, and there were there are some developments happening in some what were vacant blocks of land very close to where I live. And they are those sorts of developments where you have a number of small modular style homes being set up on vacant land. And I was involved in my local neighbourhood, I am involved in my local neighbourhood, and was really distressed to see the reaction of our neighbourhood to these emerging developments. There was a group that was formed in my street that was about petitioning the local council to keep those people out of our neighbourhood. They used every excuse to talk about car parking issues, crowding issues, quality of housing issues, the whole lot. They worked with the council, they attended community meetings, and they did everything they possibly can to stop these developments. The buildings are being built. There are many of them that are nearing kind of occupation, I think. And we still have this undercurrent in our community that's been going on for, I don't know, 18 months to 2 years, that is not about welcoming these people at all into our neighbourhood. I am really concerned and somewhat distressed that a group of people are going to be given a house, they're going to be supported in their house, and yet we have a community, my community, that is not in a position to welcome, include, enable them to feel belonged, or at all put out a hand of friendship or welcoming. My community is diverse. We have things like welcome wagons for refugee communities that are settling in our area. But we have failed to change the attitudes or to change the willingness of our community to embrace these new neighbours. So what I would say is that housing is absolutely critical, that support is absolutely critical, but there's this missing piece that how are we working at a community level with local neighbourhoods to welcome people into their houses? Because it's only if we have that community piece that the full citizenship that Joe was talking about, that Nigel mentioned, is going to be possible. And without that, recovery is not possible either. So I would love the conversation to change into, there are 3 things that are needed. There is housing, there is support, and there is a welcoming community if we're going to really break this cycle. Thank you.
Thanks, Laura. It's lovely to have you involved, and thanks for sharing the evidence-based successful Doorways program in the private rental space, and the comments about relationships with real estate agents, but also the importance of the community development component of what we're doing, but also I think the challenge of congregate arrangement, and how much preferable it is to maximise the availability for people to be spread with their different strengths throughout our community where at all possible.